Do you hear the thunder?
We do.
Hopefully,
Hello.
stays steady.
We're going to go ahead and get started. Hello and good afternoon, everyone. You might be hearing the thunder outside as we are. My name is Jackie Ruiz, Public Information Officer for the Santa Barbara County Public Health Department, and I'd like to welcome you to today's COVID-19 update with the county's public health leaders. Today marks the one-year anniversary of our very first COVID-19 response press conference. And on this day, I'd like to give tremendous thanks to our public health leaders for their tireless efforts to protect our community. And I'd also like to thank you, our local media, who work with us daily to ensure our public has accurate and timely information. Thank you. Today, you will hear from the county's public health director, Dr. Von Del Reynoso, and Dr. Henning Onsorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Cerecedo and in American Sign Language by Julia Townsend. Please note, we will be aiming to conclude our press conference by 5 p.m., so please keep that in mind when asking questions. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. With that, I will turn it over to County Public Health Director, Dr. Von Del Reynoso.
Thank you, Jackie. Good afternoon. If I could have my slides up. Great. Data trends in Santa Barbara County. The winter surge in cases is now over. Our COVID metrics, including active cases, daily new cases, testing positivity, case rates, hospitalizations, ICUs, and deaths have all substantially decreased. This is wonderful news, the news that we've been waiting for so long. And I want to thank everyone who did their part to reduce the spread of COVID-19 in our community. However, I want to stress that we must stay vigilant so that we can continue to see a furthering decline in case rates and testing positivity. Next. As you may have heard my briefing to our Board of Supervisors on Tuesday about the blueprint for a safer economy revised thresholds. So the statewide vaccine equity metric goal number 1 is 2 million doses need to be administered to persons living in the vaccine equity quartile. And when that has been achieved, the purple tier will shift from larger than 7 cases per 100,000 to larger than 10 cases per 100,000. The red tier will be widened to 4 to 10 cases per 100,000, and the orange and yellow tiers will remain the same. So earlier today, the state announced that California has indeed reached its first health equity vaccine goal of vaccinating 2 million persons in the hardest hit communities in our state. So the revised threshold for meeting the tiers are in effect. Next. I'd like to describe this graphic to you a little bit. How does Santa Barbara County progress to the red tier within the state's new revised blueprint for reopening? So as standard, as typical in the blueprint metric, the criteria for Santa Barbara County to be in a tier, we have to be in a tier, any given tier, for 3 consecutive weeks. So for the past 3 weeks, we have been in the purple tier, check mark. Santa Barbara County must meet the adjusted case rate for the next tier, which is the red tier, for 2 consecutive weeks. Check mark. This week, under the new revised blueprint metrics, we are at 9.7. So check mark, we've achieved our first week. Santa Barbara County must also meet the test positivity rate for the next year for 2 consecutive weeks. So in order for us to be moved towards the red, we have to meet the testing positivity as well. Check mark 3.6. So we have met the red tier metrics for 1 week. If we maintain these good numbers for an additional week, it will be announced by the state next Tuesday, March 16th, that we are in the red tier. So this is a moment of celebration for us as a community, but we must meet the metrics for us to get there. Next. This is an update with regards to our vaccination rate. So we have received 117,740 doses. Of that, we have administered 61,295 first doses. We have administered 33,561 second doses. With the Johnson & Johnson single-dose vaccine, we have put 352 into arms. But I want to point out that this data is 3-day lags. So we have achieved 81% of doses administered, and the remaining doses are slated for clinics happening in the next few days. Next. Vaccine distribution in Santa Barbara County. Our primary focus this past week has been to ensure that community members in phase 1 receive a vaccine. Beginning next Monday on March 15th, eligibility will be expanded to new broad sector. Individuals age 16 to 64 who are deemed to be at the very highest risk for morbidity and mortality from COVID-19 as a direct result of severe health conditions will also be eligible. And as we know, anytime eligibility opens, vaccine supplies still are very limited initially, and more vaccines will become available in the weeks to come. So please be patient as we open up vaccine opportunities to the remaining categories in our community. Next. Vaccine distribution appointments available at public health vaccination sites on Monday for clinics on March 16th, March 17th, and March 18th for members of our community in the ag and food service and in emergency services. Vaccination for transitional kindergarten through 12th, childcare will be coordinated through the Santa Barbara County Office of Ed. Vaccination for higher education will continue to be coordinated with the school liaison. The hospitals, pharmacies, and primary care partners will serve persons 16 to 64 years old with severe health conditions and the 65 plus community members. And in addition to this, the public health vaccination site in Santa Barbara will be moving next week to the Hilton Santa Barbara Beachfront Resort on Cabrillo Boulevard. Sites in Lompoc and Santa Maria will remain at the same locations. Next. So I want to remind everyone that while vaccines have arrived, there are still so many things that everyone can help to stop this pandemic. Get tested. Help us detect when the virus is spreading, where it's spreading, and stop it in its track. Not only can you stop COVID from spreading, but you can contribute to keeping our local businesses, schools, and community open. Additionally, don't forget to wear your mask when outside your home, practice safe social distancing, and limit gatherings with people outside your home. I know we can do this. We've demonstrated that we can. Please know that we are so very close to the finish line, but we really need everyone to be vigilant so that we can cross the finish line. Thank you. And with that, I'd like to introduce Dr. Ansorg, our County Health Officer.
Thank you, Director Dorenoso. Good afternoon, everyone. As Director Dorenoso just explained, we will be reaching the less restrictive red tier by next week. This will bring us new opportunities for business and entertainment venues to open up. It also presents us with a challenge to continue to be safe and not fall back into another virus surge. The only way to prevent another surge is by adhering to the good practices of mask wearing, social distancing, and avoidance of crowds and other risky behaviors. Please, everyone, let us stay with the program so that Santa Barbara County as a whole can progress to even less virus transmission and approach more normalcy. Our vaccination effort is a very big factor in reducing cases, severe disease, and deaths from COVID. Being fully vaccinated, that means 2 weeks after the second shot of a 2-dose regimen or after the only shot of the Johnson & Johnson. Being fully vaccinated will bring further opportunities for socializing. As an example, fully vaccinated people can safely meet indoors without masks. Fully vaccinated people can meet with not yet vaccinated persons from one other household indoors without wearing a mask. If a fully vaccinated person becomes a contact to a COVID case, they no longer need to quarantine, providing they don't develop symptoms, of course. These are just some additional benefits that being fully vaccinated brings, other than losing the anxiety of becoming really ill. The CDC came out with these recommendations on March 8th, and we are anticipating for the California Department of Public Health to follow suit with their recommendations in a matter of days. Santa Barbara County so far has about 10% of our population age 18 and older fully vaccinated, and give or take 15% have received at least 1 dose, which already provides very good protection against severe COVID and death. The next 2 to 3 weeks will be challenging. One of the reasons is the vaccine supply available to us will likely not increase. However, more individuals will become eligible as of Monday, as you just heard. Please be patient. By April, we should see a dramatic increase in available vaccine, and hopefully by May, everybody who wants a vaccine will be able to get it. Due to some changes in the guidance to wineries/tasting rooms, breweries, and distilleries, we are issuing an updated health officer order today outlining those changes. In short, wineries and tasting rooms, as well as breweries and distilleries, are no longer required to serve meals. However, they can operate only outdoors per reservation. Patrons need to be seated with service provided only until 8 p.m. And the length of stay of customers should be limited to 90 minutes. Bars, pubs, and brew pubs can operate as long as they serve meals, they operate outdoors only, and they are following the restaurant guidance overall. I am hopeful that we are on the right track to finally tackle this pandemic successfully for Santa Barbara County and the country as a whole. Thank you for your cooperation.
Thank you, Dr. Ansorg and Dr. Del Reynoso. Just a reminder to media, we will be concluding our press conference by 5 p.m. today. With that, I'll turn it over to Blake Devine from KEYT to be followed by Tom Bolton from NewsHawk. Blake?
Thank you, Jackie. First question for me, I just wanted to clarify, Dr. Ansorg had said that we are going to reach the red tier next week, but Dr. Do Reynoso had said we need one more week of reaching those red tier numbers before we're eligible to reach the red tier. So I want to clarify, when could we actually be in the red tier, meaning things are reopening? I want to clarify when that will be, possibly.
March 16.
Yes, I was about to say the same thing.
Okay. So we've had our 2 consecutive weeks of reaching those numbers. And so we could see on Tuesday a health officer order, meaning we are now in the red tier, and all those restrictions that allow us to reopen will be open on March 16th, Tuesday.
My understanding is that the new health officer order will be in effect starting on Wednesday, the following day. And yes, that's what we're anticipating.
Perfect. Could you just clarify, what will that mean for secondary schools? Will they be able to reopen?
Yes, providing they have safety protocols in place, just like the elementary schools, they will be allowed to open up for in-person instruction. That is correct.
Makes sense. I just wanted to know, what was the thought process behind the new health order going into effect today with the wineries and breweries no longer required to serve meals, but the bars and pubs must serve meals? What led to this decision?
That's a good question. A lot of stakeholders, they reach out to the government, the state government, and make a plea, and sometimes have very good arguments. And these things are debated and deliberated at length, and then guidances get updated. That happens on a regular basis, and it's usually just with frequent, a question and answer and frequently asked questions update, which is binding. But we felt compelled this time that we actually have to mention it in a health officer order so that they're safer to operate under the new guidance.
And then a last question for me, this was from a viewer, but according to the website, it no longer confirms whether or not 50 to 64-year-olds will be able to get vaccinated after phase 1B wraps up. Hoping you could clarify what is next to come after those phase 1B people get vaccinated. Will the 50 to 64-year-olds be next?
Well, I can take a stab at that. The honest answer is we don't know yet. My hunch is, this Monday, everybody age 16, that's the youngest age that who can get a Pfizer vaccine, up to age 64, with underlying health conditions, is eligible for a vaccine. Then healthy people in the whole spectrum of age will be eligible thereafter, and that means everybody. So depending on vaccine supply, that will be opened up as it seems feasible.
Makes sense to me. And I guess last question, I just really want to confirm this. Are we set to reach the red tier, or is it still tentative with a high possibility?
Well, my crystal ball says 99.5%. What does yours say, Dr. DeRosa?
Mine says, what was your percentage?
99.5?
Mine is 99.6. So I think that we'll get there.
Okay, thank you guys so much.
Great. Thank you, Blake. Next, we'll turn it over to Tom Bolton from Newshawk, to be followed by Brooke Holland from Newshawk. Tom?
Thank you. Good afternoon. I wanted to follow up on the question on the issue of the 16 to 64 group who have medical conditions. My understanding is that people will be self-attesting to those conditions. Is that correct? Or is there some other process in place for people to essentially say that they qualify?
That is correct. That per CDPH guidance, the community members will be required to do self-attestation, either through the registration process or on-site.
Okay, thank you. Another question. A number of counties in California are not inclined to go into the Blue Shield system for managing the vaccines. And I'm wondering where Santa Barbara County stands in that, both their view of it as well as what efforts you've made to either be in it or not be in it.
We've been in discussion with Blue Shield with regards to our third-party administrator contract. However, the state is moving away from the contract with Blue Shield, so counties most likely will be proceeding with an MOU, not with Blue Shield, but with the state. And that's half of the picture. The other half is My Turn. The county has been onboarded and will be proceeding with moving towards My Turn and awaiting for the go live date.
Okay, so it sounds like Blue Shield's sort of not going to be the program after all.
Well, no, it is. So Blue Shield is the program, and they are contracting with the healthcare system providers. But for the local public health departments, it's an agreement between public health at the state level and public health at the local level.
Okay, I see. I've been contacted by several people who are home health care people for like elderly parents. One person has parents in their 80s and 90s, and they're wondering where do they fit into the vaccination scheme, not their parents, but themselves, because they're not actually medical people. They've contacted 211 and basically been told you don't qualify.
So absolutely, that's a great question, and we do get this question from time to time. As a care provider for their parents, they are eligible to be vaccinated right now.
So how do they do that?
They can either call our 211 and we will ensure that our 211 gets updated guidance, but they can also call the pharmacies, the CVS, the Rite Aids. They can go into My Turn and also schedule an appointment via My Turn.
Okay, thanks. In light of the recent CDC recommendations, will there be a change coming for the health orders regarding skilled nursing and similar facilities in terms of visitation?
That is not necessarily managed by a health officer order. The licensing authority from the state health department sends so-called AFLs. Those are, letters that are giving them guidance, and the facilities have to abide by those. That's pretty much what I can say to that. So far, the skilled nursing facilities do have visitation, even indoors. And it depends sometimes on the situation. If they, for instance, they need to be cleared, have been cleared for 2 weeks from any COVID cases and things like that. So the individual facility might be in a slightly different situation than another one. And it's not like one size fits all, but the guidance is in place for the skilled nursing facilities. And if it changes to a degree that an additional health officer order is required, by Tuesday we will have a new one, and that will likely be part of it then.
Okay, thank you. My last question is real quick, and you can provide the answer offline if you'd prefer. I'm just wondering which zip codes in Santa Barbara County are part of the 400 most valuable identified by the state, and which communities those are.
I have those, and I can email them to you, Tom.
Okay, that would be fine. Thank you.
Great. Thank you, Tom. Next up, we have Brooke Holland with Newshawk, to be followed by Atmika Iyer from Daily Nexus. Brooke.
Hi, thank you. With spring break approaching, I was wondering what guidance public health has for residents, and if public health is anticipating any cases to spike after the holiday break.
Yes, we urge everybody to plan their spring break differently this year. We still have substantial and widespread transmission of the virus in the community. We still have a lot of people who are receptive to the virus. There is still a California travel advisory in place that recommends not to travel further than 120 miles from your home. So we are appealing to people's sense to please avoid travel at this time. Give it a few more months and we will get this under control. But right now it's not a good time to travel.
All right. And let's say someone does decide to travel and they come back into the county. What should they do when they come back?
They should quarantine for 10 days to make sure they don't develop symptoms and get tested.
All right. And right now, could you just go over again who should be receiving or getting a COVID test? What's the current public health guidance in regards to like COVID testing? Who should be getting it?
Anybody who has been in contact with a COVID case should get tested. There are many industries, including schools, the sports teams that need regular testing per guidance. That will continue even in the red tier, especially the high contact sports teams, just like the college athletic teams are doing a daily test even. So there will be a lot of need for testing, and we want to make it as easy as possible for people to take advantage of that. It's at no cost to you. We are opening with a mobile testing unit on East Beach. And so we want to make it as convenient as possible.
All right, great, thank you. And then just a clarifying question, if we move into the red tier on March 16th, and then a health officer order is written, we can anticipate the business changes to go into effect March 17th?
Correct.
Okay, great, thank you.
Great. Thank you, Brooke. Next up, we have Atmika Iyer from the Daily Nexus, to be followed by Fabiola Navarrete from Tu Tiempo Digital. Atmika?
Hi. So my first question is, there are some winter storms anticipated this upcoming weekend. Do you guys expect there to be any delays with vaccine shipments because of those winter storms?
I have not. That's always a possibility, given that the previous winter storms did delay shipments, but I have not heard of any anticipated delays for this weekend.
Got it. Thank you. My second question is, well, the first part's clarifying, but is it true that Blue Shield will not be contracting with the university in providing vaccines? If that's true, could you explain why? And if there is a plan to target and vaccinate college students in another way?
I can tackle that. So the UCs are part of what is known as an MCE, which is a multi-county entity. And the UC health system is an MCE and I believe is receiving vaccines. However, the UC health system have decided to not allocate vaccines to UCs that don't have a medical school attached to it. So I believe that that's the situation. With regards to vaccinations in the UC community, we have been offering vaccines to all the eligible populations. Right now we're doing childcare and education. Previously, we were doing 65 and above. So all those eligible populations are being served currently outside of the university. With regards to when students can be vaccinated, if you have a comorbidity, as Dr. Ansorg mentioned earlier, 16 to 64. If you have an existing a pre-existing condition, a comorbidity, you are eligible. Otherwise, we are going to await for further vaccine allocations from CDC and guidance from CDPH.
Got it. Thank you so much.
Thank you, Atmika. Next and last, we have Fabiola Navarrete from Tu Tiempo Digital. Fabiola.
Okay, hello, good afternoon. Well, my first question is about Santa Maria and the vaccination sites. Well,